Most patients will need just a cardiac clearance if you're over the age of 55. If you're under the age of 55 and you have no medical issues, I can do a general medical clearance when I see you in the office. If you have any kidney issues, you may need a nephrologic clearance or transplant clearance. If you're on dialysis, you'll need clearance from a nephrologist. For the most part, your clearance is usually cardiac. And we want to make sure that your heart is strong enough to tolerate the anesthesia to put the implant in. So you can confirm insurance coverage by calling your insurance company and asking if CPT code 54405, that's 54405, is covered on my plan. If it's covered under my plan, then you're covered. If it's not covered, then you're not covered under that plan. Medicare is covered, 80/20. Medicaid is not covered. So those are usually the breakdowns, but individual plans, or Blue Cross, United, Cigna, Aetna, these vary from state to state, from plan to plan. So you should call your insurance and see about if the implant's covered under your plan. You need to arrange for transportation because you're going to sleep, and you need to have a driver pick you up. When you wake up from anesthesia, you will be sedated and dizzy and maybe nauseous or sleepy, and you can't use Uber. You need to have somebody that knows who you are pick you up and take you to your hotel or your Airbnb or your house after the surgery. So in the days before your surgery are really important for vacuuming, right? So a nice article that I show with my patients talks about vacuum stretching at least 4 to 8 weeks before surgery. And what you want to do is you want to put your penis inside the vacuum erection device chamber, hold it hard for 10 minutes, at least once a day. If you have penile scarring, penile shortening, or curvature, then you want to do it twice a day. And you can do that all the way up to the night of surgery. The night of surgery, and if you can, the morning of, you may want to use Hibiclens. I like my patients to wash with a soap called Hibiclens, Hibiclns, also called chlorhexidine, for the neck down. You want to make sure that you scrub, and that just decreases the bacterial load on your body before the surgery. We don't want an infection, and we can minimize it by doing antibiotics, having you scrub with chlorhexidine, using a no-touch technique, and these are really important things that we do. Do not eat or drink the day of your surgical procedure for 8 to 12 hours before your surgery. That's coffee, tea, gum, water, nothing. Please don't shave before your surgery. If you get an ingrown hair, I will cancel your surgery because I do not want an infection. It's not worth you risking an infection before surgery. So let us shave. We'll get some nick marks, but you'll have antibiotics on board so we won't get ingrown hairs. Because if you shave at the house and you don't use antibiotics, or you don't use a sterile field, you may get ingrown hairs from shaving. So we don't want that. So don't eat or drink at least 8 to 12 hours before your surgical procedure. It'll vary from different types of anesthesiologists, but usually they want about 8 to 12 hours of nothing by mouth. That's water, tea, coffee, anything, gum, nothing by mouth at all. The day of surgery, I would bring tight-fitting underwear. I'd bring loose, baggy pants and a long, baggy shirt, and make sure that you have just comfortable shoes on, because you're going to need to be chill after surgery, and you're going to want to go home and relax and ice after the procedure, and your balls will be wrapped up, and it's nice to have it in a jock strap or a support, so it's easier to take care of. So the big day is here, the day of surgery. So you're going to come to the surgery center and you're going to be checked in. Once you get admitted, the nurses will kind of run down through your medical history. They'll go through your chart to make sure everything's been sent over by the office. You'll get an IV placed, and we'll start sending the nurses to get the antibiotics, and they'll start running the antibiotics into your veins. We usually run vancomycin, amikacin, and fluconazole, and we'll run that in the pre-op bay. Usually the nurses will give you a chlorhexidine wipe to wipe yourself off with from the neck down. And then I'll come chat with you for a good 10-15 minutes before surgery, making sure that you understand the surgical procedure, you understand the post-operative care, and you understand the trajectory and what's expected of you after surgery. Examples about showering, when to take the dressings off, things like that we'll review before. Advice for nervousness. It really, relax. It's easy to say and hard to do, but the team that's taking care of you does this week in, week out. You're not the first penis that they're fixing, maybe even that day. For my team, I usually tell them, hey, take it easy. We'll give you some Xanax. If you just tell the team that you're a little nervous when you arrive to the surgery center, they'll usually give you something. As long as your consent form's signed, you'll be good, and we can give you something to get an anxiolytic in the system. But I anticipate you being nervous. It's your penis. You got one of them. This has got to go right. So yes, you should be nervous, but just know that the teams that are taking care of you, if you go to a center of excellence, they're doing this week in, week out, and it's routine. If you have questions before the surgery, I would call the office at 404-400-3120. That's 404-400-3120. And I would chat with LaWanda, my scheduler, or the scheduler in the office, and try to get your questions answered. You can also email me at thakky@atlantacosmeticurology.com. That's Hakky@atlantacosmeticurology.com.